We are just getting set up. So we've gone live. So now we have to share to a couple different pages and then we're going to be ready to go. So stay tuned. We're excited. Thank you. How do you go live on Instagram? All right, we are live. Now we just have to figure everything out. Hey, everybody. Getting you in the selfie stick. And getting adjusted. All right. All right. Dr. Geyer is going to go get some water, and then we're going to get started. I'm so excited you've joined us. I'm going to start sharing in the event and on Dr. Geyer's page and in a couple of groups, and we're going to be ready to go. So thanks for bearing with us. If you're here, say hi. We would love to hear from you. Thank you for your patience. There we go. Now I can share. You almost ready? All right. There we go. Almost ready, everybody. Thanks for joining us. And just one more, and then we're ready to go.
We promised to share a picture of what this looks like on the other side.
We were having some technical difficulties that we just figured out, so
we have 3 computers and 2 phones going.
Nope. All right. We're ready. I think we're in everything we need to be, both pages and a couple of groups on our event. So, and then looking at us on the screen is always weird because we're opposite. So, All right, we're ready. So today's topic is one that is super near and dear to my heart. This is where I got my start as a health coach, and it's autoimmune disease. Take back your life. We're very excited to talk about this today.
And I have to say, this is the #1 group of diseases that my patients have. So it's a very broad group of diseases. We're going to try and give you as much information as possible in a short amount of time, so that you feel really empowered leaving this.
Our goal is not to leave you overwhelmed, but to leave you feeling like you have answers. You can go to your doctor, whether it's Dr. Geyer or a local rheumatologist or whatever, and just feel really confident about what you're asking for and know what is in your control. And so that's our goal for today.
Yeah.
Yep. So we do have to do a disclaimer. This presentation is for educational and information purposes only and should not be construed as medical advice for any individual. We encourage you to speak with your physician, schedule an appointment for an appropriate medical evaluation, testing, and treatment recommendations. This, again, is just information to leave you feeling empowered by the time we're done today.
Mm-hmm. Hello. I see people joining.
Yeah, hi, guys. All right, so who are we? Dr. Geyer, why don't you go first?
I'm Dr. Geyer. I'm an integrative physician, and I could talk about all the experience that I have, but I thought it would be kind of cool to talk about how I started. So I was a preemie baby. Long before I was a doctor, I was a preemie baby, and I had a lot of health issues. They said I had sudden infant death syndrome, and I'm still here. And then by the time I was about 7, I was diagnosed with kidney disease. And by the time I was in my early 20s, it was polycystic ovarian disease, PCOS syndrome, and then it was early ovarian failure. And it's been a succession since then. So that's what really drives me.
Yeah, and my name is Marian Mitchell. I'm an integrative nutrition health coach. And I guess I can start with my story. Growing up as a kid, I was also born early. And I was actually born with my hips dislocated. But I wasn't born breech, super weird. And then after my 2-month vaccines, I developed asthma. I also suffer from psoriasis and ovarian cysts, or I used to. And then about 9 years ago, my dad was diagnosed with an extremely deadly autoimmune disease called recurring polychondritis, which normally after diagnosis, they die after about 10 years. Because it attacks the cartilage in your body and dissolves it, and your organs are a lot of cartilage. And his is located in his face, mostly in his ears, but then you have your esophagus. And then my daughter, about 3 years later, was diagnosed with celiac disease. And I really just wanted my dad to be around for way longer than 10 years. And I wanted my daughter to have a full life without feeling deprived. It was really important to me. And then overcoming my health issues, like I don't suffer from asthma very often anymore. I don't have ovarian cysts. My hormones are pretty stable these days, I feel like. So like there's so much in our control, and that's what we want to share with you today. We're really excited about this.
And we're excited, obviously we're excited because not only do we see patients get better all the time, but we wanted to share with you where we come from. So I have 5 kids with my premature ovarian failure, where I never had kids at 20. And I also have a son with autism and a lot of family members also with autoimmune diseases. So this is something that we are struggling with, that we have surpassed in so many ways, not only with ourselves, our families, and with our patients,
Yes.
and had so many successes. So we want to make sure that you feel empowered and you also feel really successful. Okay, so autoimmune diseases, this is, they're such a ballywhack. They're such a, I know, it's such a ballywhack. I mean, so some sources say there are over 80, some sources say there are over 100. Sometimes they're including things that are really just idiopathic into the autoimmune category. That means we don't know what causes it. Just great, right? But you can see, as I'm assuming most people that are attending or are going to watch this later either have symptoms nobody can figure out, which is a lot of our patients, have been diagnosed and just don't feel like they're getting anywhere. And that's because once your body starts attacking itself, it does it in a lot of different ways. So thyroid, bones, muscles, skin, lung, GI tract, etc.
And then if you don't address one, it's usually you develop one, you start, it's a domino, you start developing more because you're not stopping the body from attacking itself. You mask symptoms. And so then celiac disease also goes hands in hand with Hashimoto's and then become RA. Like there's just kind of this progression. So what we're going to be sharing with you today is going to be foundational for making sure you don't cascade.
Okay, so a healthy immune system, sometimes I think it's easy to forget this. Like my patients will be like, why does my immune system hate me? Like it doesn't hate you. That's not what happened. So it feels like here's your friend that was sitting at the fence protecting you, trying to make sure that, you know, bacteria, viruses, toxins, cancers, things that are called antigens or might be harmful to you, it creates these antibodies, this immune response, and it protects you. And you never even know most of the time. I run labs all the time and people's white blood cell count is up or their neutrophils are up and they're like, I didn't feel anything. I'm like, that's because the immune system normally, unless it's really fighting, we're fighting stuff off all the time.
All the time.
But I kind of think of it, an analogy is like when your best friend gets backed into a corner, like your puppy gets backed into a corner. I don't know if you've ever had this. We've always had lots of animals. And let's say they were fighting or something, and then you approach them and you try and break them up, and then they attack you. And that's what it feels like. It's like, whoa, you're my friend. Like, what's happening? Why is this happening? And a lot of times, what the explanation given is we don't know, right? Like that's the worst. That's the worst feeling. Like finally you might be getting close to an answer, and then you don't know because it's in response to an unknown trigger. The immune system just starts attacking you. The other key piece is that for most general practitioners and in the emergency department, in a lot of these places, doctors hate vague symptoms, right? So it's really hard. It's like, well, unexplained and ongoing. It could be fatigue, generally not feeling well, dizziness, fainting spells. Because remember, this could be your circulatory system, so your blood vessels. It could be your nerves that it's attacking. It could be your thyroid. It could be your joints with swelling. You could have skin problems. Maybe it's eczema, psoriasis, lupus.
I've had clients get open boils from their autoimmune disease, and the doctors have no idea.
Abdominal pain and digestive issues. So I have a lot of friends that are ER physicians, and I was previously married to one, and he would always say, like, this was their nightmare in the ER. Abdominal pain was like the number one thing that they hated because it could be anything. It's so bad. Like, there's so much in the abdomen. So if any of you have, we were just talking about IBS, but irritable bowel disease, it's super hard to get to that diagnosis, and sometimes it changes. You thought you had Crohn's, and then it was ulcerative colitis, flip-flop, whatever it may be.
Yeah.
Recurring fevers, which is hard to prove at the doctor when you go, hey, I had a fever yesterday, and they were like, did you take your temperature? Yeah, I took my temperature. I had a fever yesterday, and I had one last week, and then I had one, and it's hard because we do spike little fevers when we're getting sick. We spike fevers sometimes, not a true fever, but our temperature will go up with allergies.
Yeah.
I'm seeing that a lot right now. Swollen glands, there's so many symptoms, right?
And again, it can attack every organ in the body.
Yeah.
So chronic pain and maybe swelling and just, it could be literally anything.
Mm-hmm.
Yeah, acne.
Okay. So we wanted to give you the basics, and some of you may have already gone through this, and some of you may be just exploring and trying to figure out, where do I even start? What do I ask my doctor for? Because not all doctors are as receptive, or it might be harder to get them to run labs. So these are the basics that pretty much any doctor will be responsive to. Now, one thing that they may talk about is your insurance won't cover this. And so they just need to code appropriately. And that usually covers most of these basic ones. Now, CBC, CMP, CBC is your white blood cell count, your red blood cell count, and all of your immune cells. So that should break it down, the size, shape, and color of your red blood cells. Very easy. This is part of your standard blood work. CMP is your kidney and your liver function. This should also be part of any standard blood work. And then it goes into some other ones. So ANA, anti-nuclear antibody with a reflex or a complete, that's where it starts to go into all of the antibodies. So if the ANA is positive, if it's a reflex, it'll be positive, and then they'll start to look for things like, lupus markers and Sjogren's markers, etc. If you're looking at rheumatoid arthritis, rheumatoid factor, anti-CCP is missed a lot. It's an early marker, so it'll show a positive before the rheumatoid factor does. Spondyloarthropathies are hard because most people have back pain, and it can actually come up positive in a lot of other ones. But there's a very specific one called HLA-B27. So those might be harder to get your primary care to run, but they're pretty easy, and you can get them covered by insurance pretty easily. SED rate, so ESR, inflammatory markers, and a CRP, C-reactive protein. I often run a CRP high sensitivity. The high sensitivity tells me it's a cardiac marker, but if it's above 10, it'll tell me that there's something else going on. Sometimes insurance won't cover both of these, and they're a little bit different. And then thyroid. So I think thyroid is the most well-known, especially the Hashimoto's and the Graves'.
Look, I have to tell you how many people have normal markers and then they get tested for Hashis 3 to 4 or 5 years later after feeling super tired and then really going downhill and gaining like 30 pounds in 30 months. And all of that. And that's usually when the doctor's like, okay, that's weird, let's run a Hashis, when they could have tested it a long time ago but didn't want to because you were just tired and you're a woman, so.
Standard guidelines still tell us to run a TSH, and they're still telling us that running T3 and T4 are not useful, and knowing whether or not it's autoimmune is not useful because it doesn't change treatment. So I can tell you this is absolutely not true. But having worked in insurance and playing within the insurance model, sometimes that means that we have to run 3 and 4 sets of labs to get there, or we have to code even more diligently for it. So fatigue is a rough one. Like most people I know have fatigue on any given day, even if it's not a chronic piece that doesn't allow them to get out of bed. Most people have some kind of pain. So how we're coding it makes a big, big difference. So that's something to talk to your doctor about. But thyroid, I wanted to break it down so you can see thyroid stimulating hormone, free T3, free T4, thyroid antibodies, and I often run a reverse T3 in there as well. So I can see how they're...
I'm surprised that wasn't in there.
I know. You know what? I think I wrote it in there and then something happened. I probably hit delete. But to see how your stress is impacting.
She says she's so lucky you're her doctor.
Ah! Hello!
Hi!
So this is basic, and any of your GPs should know what these tests are.
But again, getting them coded correctly, especially if they're not well versed in it or don't believe in it, or their billings person hasn't been trained in how to code appropriately. Because I have a couple of medical billers in my world, and stuff changes all the time. And unless they specialize in that, it's actually really hard for them to even know what the correct codes are, which can be really frustrating for my clients, especially.
For sure. Okay, so what also needs to be tested, these don't always make it in the standard panels. I hope your doctors are running an iron panel with ferritin, and this is for more than one reason. Obviously, iron, we're looking at, people who don't have energy. You can have all sorts of symptoms from having low iron. If you've ever had it, I mean, your hair is falling out, you're bruising, you feel exhausted, you're cranky, you feel like you can't lift your legs up, you can't get out of bed. All of these interesting symptoms, your skin is super dry. There's a lot of overlap between those nutrient deficiencies and things where people were like, I'm sure it's thyroid. I'm like, it's not thyroid, but it's something. So let's keep digging. B12 is the same way. So super important. Vitamin D is another big one. And it's interesting because I would expect vitamin D levels for me and my patients in their labs right now to be coming back higher than ever. Because a lot of people are saying, I'm taking vitamin D to protect my immune system and support it. And they're actually coming back lower. So remember, getting outside is super important.
Yep, supplements only aid. They don't fix it all.
Yep. And then this one, so I'll give a little bit of a story here. Vitamin D has to be coded correctly. And sometimes this is an insurance issue as well. A lot of insurance companies have started saying, I'm not covering this because it's experimental, which is really interesting. So for some of them, unless it says vitamin D deficiency, they're not going to cover it. Here's another little tidbit is if you don't think your insurance is going to cover it, there are really competitive cash pay labs out there.
Yeah, you can get it for really inexpensive.
So I know that, as an example, my mother-in-law wanted a vitamin D. She asked her GP for it. They said insurance won't cover it, and they didn't. And the cash pay was really expensive. So there's no reason for that. The cash pay labs are out there. Your primary care is your advocate. They should be your advocate. So I am always comparing side-by-side labs. I mean, I can get somebody a really good hardy panel for about $200, $250, and then they get that same panel and it's $1,000 through Cinerequest or LabCorp. Yeah. I never use them unless I have to for cash pay labs.
I do know that through LabQuest, a vitamin D draw, even without a script, is only $50.
Mm-hmm.
Yep.
Makes a big difference.
Shopping around is really important, especially if you have a high deductible plan or something like that. You can shop around and find all kinds of. One place will charge $200, another place will charge $30. And it's really important that you take the time to shop around and don't just walk in expecting it to be affordable.
Yep. And some of them you can go straight to, any lab now or whatever they may be, or get them from Ulta, or I know here they have MyQuest where they have direct-to-patient labs, which are limited. For me, I use a lot of other labs and I kind of cost compare because I'm going into specialty quite a bit. Homocysteine I put in here because this is so important as an inflammatory marker. And if I'm thinking somebody has an MTHFR genetic variant, which if I'm thinking autoimmune, I want to test MTHFR every single time now. Now, 10 years ago, maybe not. And then 5 years ago, people were like, hey, we better start talking about these genetic, they're called polymorphisms, where you have a variant that was inherited. And here's the thing, I'm a big fan of hacking genes. So here's one that you can hack, the MTHFR if the homocysteine comes up positive, and it's less expensive than running the genetic test itself.
Awesome.
All right, so this is going to be really hard to see, but if you want a copy of the PowerPoint, then let us know. Just shoot us a message, do it in.
Yeah, if you haven't signed up for our newsletter yet, you can send Dr. Gar an email, or you can sign up for my newsletter on my website or even on Facebook. And tomorrow we'll be sharing this link again, and also a link to the PowerPoint. So that's, if you're a patient of Dr. Geyer's or a follower, we definitely recommend sending her a DM with your email address. We can add you to her newsletter, and then I also will be sending it out tomorrow. So make sure you sign up, that way you can have access to it.
Yep.
And then you'll be able to see all this nuanced stuff.
Yep, so when we're talking about autoimmune and we're talking about beginning markers, the ANA is brought up almost every single time, right? That's where we're going to start with the ANA with reflex. This is from UC Davis, and it talks about the ANA. If it's positive, it starts to, this is called the cascade. So you can see here, there's like, anti-SSA, anti-SSB, anti-Smith, and it gets very, very nuanced, which is why so many general practitioners and primary cares are like, nope, go to a rheumatologist. Nope, I don't do this. And then if it's negative, it's ignored. And that's kind of important, because every once in a while, someone's borderline here, and I've rerun an ANA 6 months later, and they've been positive.
I think that's probably why it takes 3 to 5 years to get a diagnosis, because you're subclinical, and then you just keep getting worse and worse and worse until you become clinical, and that's when all of a sudden they'll start digging, and by then it takes a really long time to come back.
Yep. Also, because different labs have different reference ranges, which is what I talk to my patients a lot about, is that if you run a vitamin D through one lab, their lower limit of normal might be 40. Another lab might be 30 or 35. Another lab might be 25. When the ideal range is 50 to 75. So super important to actually know what the ideal range is, because remember, they get those reference ranges by sampling the population, any particular population, and then taking the average.
I would have to say, out of the hundreds of clients I've had, I've only had one that was like 45. All the rest have been like in their teens or lower 20s.
Yeah.
I've even had a couple at 9. Yeah. And they feel like poop.
Yep.
So, and that's one thing, a supplement gets them in some time outside during their lunch break.
Yeah. And I posted it yesterday. This is, it was, oh gosh, I forgot her name now, from Brigham and Women's.
Oh yeah.
Where she actually went on to Medscape and did a video. It's a really great video if you'll watch it, but there's an excerpt from it that talks about all the research about vitamin D and its antiviral, its immune support, and specifically for COVID. And she literally says in there, so physicians, I need you, she's like imploring physicians to actually recommend vitamin D to their patients and telling them to get outside in the sun.
Which is so funny, because we were quacks for suggesting that until this season of life.
I know. Okay, so sometimes imaging is appropriate as well. This is important, especially when my patients start to have, really bad pain in their hands. They might need x-ray of their hands or hand. If they start to have deformities, I want to know exactly what's going on in there. And so when we say x-ray, a lot of people just think chest x-ray. But remember, we're talking about bones here, so that's what we image in an x-ray. Ultrasound, depending on what we're looking at, might be appropriate. And I threw this in. I just have so many patients with IBS and IBD and reflux, so irritable bowel disease, irritable bowel syndrome, reflux, horrible abdominal pain, unexplained abdominal pain, all sorts of things. And then there's a whole autoimmune liver diseases, autoimmune hepatitis. I mean, it cascades quite a bit. And so it's appropriate to get an endoscopy and a colonoscopy for some of those patients, because you just can't get to a diagnosis. Like I've had people say, oh, but they did an x-ray and told me that I don't have irritable bowel disease. And I'm like, that's not how that works. Like that's not at all how that works. So it's really frustrating to me. Or like, They did an x-ray or an ultrasound and told me I had an ulcer. And I'm like, really? Okay then, great. It's really hard for me to keep my game face on sometimes. I have a really hard time.
I feel like the more we do these, the more authentic we speak our minds.
Yeah. So, and then what? Here's what usually happens. For most people, when they get their autoimmune disease diagnosis, we're talking meds. I mean, that's the option that you're given. It's either, well, we can start and see if your symptoms get worse, or we're going to move to medications.
And then medications are, we're going to try one, see what happens for like 6 or 8 weeks, and then we'll see if it works or not.
Hopefully you don't have an allergic reaction to it. Yeah. Okay, so these are hard to see as well, but you'll be able to see them. I wanted to include them so you can see, like, this is irritable bowel disease. Classes of biologics, there's cytokine blockers and integrin blockers and interleukin blockers and TNF alpha blockers. Are you getting a theme here? And so these can be very important and useful for patients at different times. Then over here, this is the treatment of rheumatoid arthritis. There's corticosteroids. Now, these overlap with different autoimmune diseases, which is why I like to these algorithms so much, is that we use them a lot in medicine in general. But NSAIDs, disease-modifying anti-rheumatic drugs, and then the biologic agents you see here. And then, of course, right down here at the bottom, they actually use non-pharmacological management, education, physiotherapy, rest, and exercise, which I don't think I've ever had a single patient come in who's been educated on that by their primary care by the time they come into me. No, that would be great. I'm really hoping that changes, but right now, that has not been my experience. I hope it has been yours. Yes. Okay, and then I had to include this. This is a special place for me. I'm going to try and keep my game face on a little bit here, but I cannot promise it. So this is fibromyalgia, and it says patient education first, which usually they say, hey, we don't know what causes this, right? There's your patient education. Great job. And then there's diffuse body pain, sleep disturbance, mood, muscle deconditioning, and fatigue. And as you go down, it says acetaminophen, tramadol, NSAIDs, so your analgesics. And then below that are anticonvulsants, so gabapentin. Then antidepressants down here are, your duloxetine, etc. Again, here we have more antidepressants, more anticonvulsants, muscle relaxants, and then hypnotics. Hypnotics, yes. And then mood, there's psychological interventions. They actually include those for mood, so relaxation techniques, cognitive therapies, and then antidepressants, right? And then muscle deconditioning. Here they finally say, hey, you should probably move your muscles. And then fatigue, physical activity, and stimulants. And so this is
so we got downers and uppers going.
This is usually when my patients come in and they're taking Vyvanse during the day and Zolpidem at night. And I'm like, okay, let's see if we can move this marker a little bit. Let's see what we can do here.
I think my favorite with my fibro clients is that they go to their doctor and they're in systemic pain and they're super tired and they tell them it's all in your head. Here's an antidepressant. Mm-hmm. And that's like where it starts until, again, they become clinical.
One of my mentors during medical school, who I spent 2 years with, and I absolutely adored her. I remember a fibromyalgia patient coming in. She's like, you know what this means, right? You know what causes this? And I'm like, I don't know. I'm a medical student. Like, according to this, it's idiopathic. And then I'm reading over here that it's this, right? Because that's what medical students do. They're learning. We're learning as medical students. And she goes, no, it's psychological. It's all in your head. And I cannot believe how many patients I have treated over the years that have chronic fatigue and that have fibromyalgia. And I'm like, no, just at a certain point, your body gives out. Like, there are only so many ways that your body can say it's sick. That's it. And every once in a while, people are like, should we keep digging and see if there's more diagnoses? And I'm like, no, how about we just figure out what's causing it? That's where we're at. Okay, so I love this. What happened to change your friend to that threat? And that's what I want to know. That's what I'm interested in, right? So for me, I just started. I got that answer, and I go in, I talk to this patient, okay, so we have a diagnosis. It looks like you have lupus. It looks like you have rheumatoid arthritis. It looks like you have celiac. It looks like you have, this, that, or the other thing. Or we don't know, but I still believe you. I understand you're feeling all this. We're going to keep digging. So the first thing I do, make a timeline. It's like a domino effect. Ultimately, that's the outcome, right? That's like the last little bit. We talked about this before, is the teacup analogy where, drip, 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 drip. There's environmental factors. There's genetics in there. There's all these things that have happened. Let's say you had some viruses. Let's say you had this, and then eventually it spills over. And that's where that timeline comes in really important, because it makes a big difference.
Right.
So, okay.
This is why I love working with naturopathic doctors right here, because they dig deeper. They're going to look into what some of the triggers could be, because your body doesn't just decide to attack itself. You're not just genetically disposed. You're not disposed, and it just decides to turn on randomly. No, there's something that pulls the trigger. There's something behind the smoking gun, right? So, again, my first experience with it was my dad. I knew I had psoriasis, but I didn't really know that was an autoimmune disease. I just knew my skin itched, right? But when my dad got diagnosed, and his rheumatologist was like, go gluten-free, which was like, whoa, hey,
That's pretty good.
It's pretty good, right? So yeah, we have food sensitivities. We're looking for, we're doing celiac. We're looking for nutritional deficiencies. And then we're doing things like mold toxicity, which I think is pretty popular these days. I feel like it's coming to the forefront a lot. I see, at least in my world, I see a lot of it. And then viruses. So you want to talk about that?
Yeah, so all of these things, I tried to list them out, are kind of like, they're the big pieces that I see in autoimmune diseases. And oftentimes people come in and they already have an idea by the time they've gotten to me, and they're like, I want you to run a food sensitivity panel. I want you to run, a mold panel. And sometimes they're dead on, and I'm like, yeah, let's do that. And other times I'm like, well, we don't have any exposure to mold that we're aware of, but you had that really horrible flu when you were a kid, and then you've had this fatigue on and off you've been prescribed antidepressants for because they told you that you were depressed and you need antidepressants. Let's check viruses, because viruses love to do that, right?
Yeah.
And now you have, let's say, Hashimoto's. So one of the most common long-term side effects, it's called sequelae in the medical world, of having Epstein-Barr virus is Hashimoto's hypothyroidism. And so that's super important. If somebody has Hashimoto's, I'm almost always checking for Epstein-Barr virus.
That's really good to know.
But it doesn't mean I'm not going to check for mold or food sensitivities or all these things, because anything that causes the immune system to freak out causes the immune system to freak out.
Yeah.
And some people are like, no, I lived in this moldy house and we found this black mold, or whatever it may be. And every once in a while, it's like, sometimes you or I have a feeling. I'm going to explore it if I can. The hard part is a lot of these tests are not covered by insurance. So these are specialty exams, a lot of them. Sometimes they are. Sometimes we can get like the viruses covered. Or I can run in mold allergy panel to start, which may or may not tell me if you're having some kind of immune reaction to mold. But other things are not. So if you're running a food sensitivity through SynORequest, you're wasting your money. That's it's not even it's a very educated opinion. Sometimes it'll show up, sometimes it won't. Those are not the same as food allergies. Food sensitivities are different immune cells that pop up. And then micronutrient deficiencies, what I wanted to point out about this is it could be an absorption issue because of leaky gut, which a lot of people do have.
Yeah.
And I don't actually love the term because I feel like it's overused, but people do have it where they have malabsorption issues in their gut. SIBO, small intestine bacterial overgrowth, or some kind of bacteria that feeds off of those nutrients like iron and B12, which we covered in some of our SIBO videos, which are on YouTube. Or you'll use them just fighting off infections. I can't tell you how many people I run vitamin C on and they come back with really low vitamin C or no vitamin C. And I'm like, okay, or you've blown through all your glutathione fighting off infections. And then genetics are down here at the bottom.
Yep.
Not really in a priority list, just kind of listed out.
Yeah, and again, that comes from an evaluation and talking and going through the timeline that we talked about, and that's where we'll be selective, because you don't want to run all of these. That would be a lot of money. But, they do give us a really good window into what's going on.
Yeah.
And it will change the treatment protocol. I think that's important.
That's the hard part. So we'll talk about that in the end, is that we can give you some general information, which is helpful and super important and helps most people to some capacity. And then it's like, okay, well, if viruses are causing your autoimmune, like that's the main cause, then unless you treat those viruses, you're not going to get as far. Or if it's Lyme or a co-infection, you have to treat Lyme. Or if it's food sensitivities and you don't take them out, you're always going to have something just beating up your immune system.
Yep.
Okay, so these are really small, I think, on your screen, but I wanted to give you some ideas of what it looks like for some of these tests, because a lot of times it's just like this weird far out thing for people where they're like, that sounds like a nice test, that's expensive. And so I'm like, no, let me tell you. So this is my test. I'll show you my wheat zoomer. And I have a lot of patients with celiac. I also have a lot of patients with non-celiac gluten sensitivity. And so what you can't necessarily see, I always thought my gluten sensitivity, well, once I found out I have an MTHFR defect, it was because of that. Because grains are fortified with folic acid, which is toxic to those of us with MTHFR defects or variants. But it turns out that it wasn't just that. I actually have a bunch of antibodies. So I have antibodies against alpha-gliadin, omega-gliadin, gluteomorphins, glutenins.
And these are all the different gluten proteins, correct?
Mm-hmm.
Because there's 14 to 16 of them. So one of the simple panels might test for the 2 most common, but you might be reacting to any of the other 12 to 14 proteins, which is why a wheat zoomer is so great, because we look at all of them so that we know if it's truly, you're truly reacting to it or not.
Huge, because I mean, these are non-gluten wheat. This is the non-gluten wheat panel, and so I come up for a couple of them. Now, not all of them, like this is an amylase protease inhibitor, which if anybody knows what these are enzymes. So those will pop up for people where they don't have the enzymes, or actually they have immunoglobulins against those. You can have immunoglobulins against zonulin and actin, which are your gatekeepers for your gut, that help keep it really tight and let things in when they're ready to be let in, but don't let other things in. And so when that happens, you have to fix that. You have to fix that autoimmune response, and then you have to heal up the gut.
Yep.
Okay. This is what an EBV panel looks like. So there's lots of them out there. It's kind of hard because it's a little bit of a moving target right now because they've changed the test a few times. So when I'm checking for Epstein-Barr virus, which is the virus that causes mononucleosis, sometimes people don't know the difference. They're like, oh, I know what mono is. It's the kissing disease, whatever. But Epstein-Barr virus is the one that causes it. And so what viruses do is they become latent, or they go dormant in your body. And when you don't feel well, or you're run down, or any number of factors, they pop out. Think of a cold sore.
Or shingles.
Or shingles. It's a virus. It goes dormant. You have stress. It was too hot. It was too cold. You didn't get enough sleep. You ate too many cookies.
You were having too much fun for too long. You wore your body out.
You're worried about the economy. Any of these things that are happening, your stress decreases your immune system. It pops out. You have a cold sore. Epstein-Barr virus is the same way. Now, when Epstein-Barr virus pops out, the immune system goes crazy. Yeah. So this is what I'm looking for in this. There's an early antigen. It's an IgG. It's called a viral capsid antigen, a VCA. And then there's a nuclear antigen. And what will happen is, if you've ever had it in the past, this is the argument I hear all the time from other doctors, they'll say, well, it's always going to come up positive. It's just a waste of money.
I heard that recently.
Right.
Yep. I definitely heard that recently.
I love myth busting. I love it. Now, here's the thing. That some of the panels will say, this is over 9. It's positive. Or it'll just come up positive. And you're like, of course, that's super helpful. That didn't do anything. These have titers, and so they have numbers attached to them. And that's important because over 21.9 is positive. This is a real patient. So these are all labs from real patients. The wheat tumor was mine. The rest of them are all real patients of mine. I thought it would be useful to actually include those. And this is one where her nuclear antigen is 143. Okay,
And
that's
positive
pretty high.
is over 21.9.
Over 21.9. Her VCA, what happens is at 600, they stop testing. They don't go over 600. That's it. It could be 1200, it could be 650. Usually one of these starts to come up, and then the other one starts to come up, and then it reactivates, think you're cold sore. And at that point, an early antigen goes high, and she was at 38.3, which above 10.9 is positive. So this is considered a reactivation. So positive, 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 a reactivation of Epstein-Barr virus. So without treating that, I can put them on thyroid hormone and low-dose naltrexone and, cleanse and, whatever.
Autoimmune protocol, all the things, and their symptoms aren't going to get better. They might improve a little bit,
Yeah.
but they're not going to be completely symptom-free. They're not going to get to the point where they feel good and they have the energy to live the life that they want to live.
Yeah.
Because the root cause, the thing that's making the body in pain or attack some certain part of it or a lot of parts of it, is not being taken care of.
Yep.
So that's why getting a comprehensive test is really essential to the healing process.
Mm-hmm. And a lot of them have that qualitative, so positive, negative, and you want to look for the quantitative, and then you want to make sure they're the right ones. Okay, so this is a stool panel. This is super important. We were just talking about this before because I tend to get on my soapbox sometimes. Like it doesn't happen that often unless you live with me, which I'm pretty sure my husband would attest to, and I think he's on here. But other than that, I try not to get on my soapbox too much in these, and this is one place I do. So the gut is very confusing, like I said, to a lot of doctors, and very confusing, obviously, to the public and patients.
Yeah.
And upper GI symptoms, it's considered upper GI, when it goes from your esophagus, your stomach, your small intestine, loop-de-loops all around your abdomen, and then your large intestine is that last portion, right? But there's a sphincter that prevents you from things going the other way, right? It's supposed to. And when that doesn't work, up here you get reflux. And when that doesn't work below, things from the large intestine back up into the small intestine. And that's an issue. Now, some people get infections in the small intestine, not because it backed up, but because they got food poisoning. And those are different ways that people get small intestine bacterial overgrowth. Now, in the large intestine, that lower segment, people often have gas and bloating, but they might have diarrhea and constipation, which can also overlap with the upper, except they usually have things like, they're really gassy, it smells really bad, those types of things, where if it's upper, it has nowhere to escape but up. Those are the burpy people that have fullness right here, that might feel like they have palpitations sometimes because it's right there in their chest, and their doctor told them it wasn't reflux. They can have more of the mental, like anxiety, depression, insomnia, although they can have them with both. And I'm a big fan of testing because if you don't test, you're basically just throwing stuff at the wall and seeing if it sticks. So I did get on my soapbox today, kind of go back a second. If you look on my Facebook or my Instagram, my post today was on SIBO because so many people believe that they can't be cured, and it's like a whole other thing. But this is a large intestine testing. So this is a comprehensive stool panel, parasitology ×3. I run these a lot on patients. They do not love collecting their poop and sending it out. I have used lots of companies, and this is the only company I've come back to. And so this is the one that I use. And the reason being, here's an example. So a lot of people are like, well, everybody has yeast. Not everybody has yeast. I can tell you that's not true. Not everybody has parasites. I can tell you that's not true. This person had providencia, which is an abnormal bacteria that does not belong there at all. And then I picked this one because they have Saccharomyces as a dysbiotic yeast. So I know a lot of patients that come in and they'll say, but the woman at the health food store said I was on antibiotics, so I should take Saccharomyces. And that is true. It lives very well as you're taking antibiotics, but you can also get overgrowth. So if you've ever read those articles on people who got drunk off of their yeast, that was Saccharomyces that they got drunk off of. It's called autobrewery syndrome.
I had no idea.
Yeah, so look it up, autobrewery syndrome. It's really interesting. It's like this person showed up at the ER and we were sure that he was drunk, and it turned out he just had a yeast overgrowth. Saccharomyces. So with this particular panel, we know what's growing. I didn't include the ova and parasite because they were negative, because not everybody has parasites. And then they do a culture and sensitivity. So they put it on plates, they see what grows. That's how we got those. And then they see what it's sensitive to, and it tells me natural agents, and it tells me pharmaceutical agents. So I'm not wasting money on uva ursi and oregano and undecyclinic acid for this yeast, because it's not sensitive to that at all. Or berberines or black walnut or uva ursi up here, or it's like mildly sensitive to caprylic acid. I can choose exactly what we should go with. Sometimes it's pharmaceuticals, and sometimes it's natural, and sometimes, most often, it's a combination. And I have had panels come back where they were completely non-sensitive to everything natural tested. Okay, so this is a SIBO test. This is what it looks like. And this is actually one that I posted earlier today, and then I posted 2 months later after we treated it, and it being completely flatlined. So small intestine bacterial overgrowth, I'll let you check those videos out. We're not going to go into a lot of detail here. We already covered that.
Yep.
But it creates, what it does is those bacteria produce a bunch of gas. And then people will wake up and they'll be like, my belly's flat in the morning. And then by the time I go to bed, I feel like I'm pregnant.
Yep.
So that's the like telltale sign where I'm like, we're checking your small intestine. It's a breath test, because remember, it comes out one way. There's a sphincter there. You breathe it out. It creates hydrogen and methane gases. And that's a little bit of an oversimplification for anybody who's suffering from SIBO, but it'll give you the overview. And then you can see those gases, so that's that lift there. But that's what one of the tests looks like. All right. This isn't marked, but this is a mold test. So this is a mold test I ran recently on a patient, and their mold allergy panel came up negative, nothing for mold. But they had this history that just didn't fit right, never will since this mold exposure. They have a lot of other things. We've gone through food sensitivities. We know that she has some genetic variants. We're already treating them. And since then, we've actually run more testing. But mold was a big piece of it. So she actually had this type of mold over here, which is interesting because when you look it up, all the literature is in the vet world because it's a reportable mold. Yes. So in animals, it's a big deal, and you report it. It's a reportable infection. But in humans, it's like humans don't get this. And I'm like, okay, well, it turns out this human has it. So now we're treating it. So sometimes things don't, you get surprises, and that's why we test. All right. These are food sensitivity panels. And so the gold standard is still to eliminate foods and challenge them. And I'm a big fan of that. There's some issues with the gut, how it's working, how those cells come together, so the integrity of the intestinal barrier. And then sometimes there are just issues of whether or not we realized at the time that we were having an issue. So there we go. We're switching. We have 3 computers and 2 phones going right now. So we're trying to make sure they're all charged. But what's important is immune reactions. There's the IgE. So those people who are like, I got stung by a bee and I have an anaphylactic reaction. My mouth itches when I eat, strawberries. Those peanut reactions where your throat swells up and you get hives. And then there's the other immune reactions. And these are delayed sensitivity reactions. So you can have an immunoglobulin G, which can happen within 30 minutes of eating something, or it can happen a couple of days later. Or you can have an IgA, which is happening right at that mucosal membrane. And so those are the people that are like, my allergy panel is normal, but every time I eat this or I drink my soy latte, I get really, really congested and I have to clear my throat and my nose. I'm like very, very congested all of a sudden. That's an IgA reaction. So that's why I like to run both of those on any of my autoimmune patients to make sure they're not eating things that are making them sick without them knowing. So here you can see the gray is an IgA reaction, and this gold is an IgG reaction. And these are cumulative. So this is coffee. I just did this one earlier with a patient. So I thought it was just fresh in my mind, where her coffee reaction, she's like, oh yeah, when I have coffee, it's awful. Absolutely awful. And I'm like, I bet it is. Look at that gray line go all the way over. Or the panels that I run check for things like soy, tempeh. This one has couscous, tofu, vegan cheese. I've had a handful of my vegan patients come back and be like, but I eat tofu every day, right? One of these every day. And I'm like, and it's making you really sick. So you're going to have to decide what you want to do there, because you think you're helping yourself and you're making yourself really sick right now. Okay. And then genetics. I tend to do quite a bit of genetic hacking, like I said earlier in my practice. And this is super important. I would say the number one that I run for any of my autoimmune patients. So if you have not gotten this, you should get it done. You can self-order these again. You can get them through lots of different labs. They're very expensive if you go through insurance, and they're rejected. Yes. It's hard to get this one covered through insurance, so I almost never run it. I think 13 years of practice, I think I've had it maybe covered 3 times. I'm not even kidding. And that's because they had relatives that had MTHFR, and there was a little bit of fighting with a couple of those on why I didn't have to fight. But this one is an MTHFR mutation, and it is important. There are 2 of the main MTHFR pathways for converting folic acid into methylfolate. And this is huge because I see this quite a bit with lots of autoimmune patients, and I've treated autoimmune patients. I think this was like my defining case a few years back, where I had done the stool panel, done the food sensitivity. I was doing all this stuff with her. She got better, but she still had symptoms. And then we ran this on her, gave her methylfolate, and her autoimmune markers went negative. Like, she went from a lupus diagnosis to a mixed connective tissue disorder diagnosis to they were gone. So her ANA went negative. And I was like, I'm running this on every single patient that has an autoimmune disease now, if I can. COMT has to do with dopamine breakdown. So you'll see mental sharpness, cognitive performance, vulnerability to stress, also pain management, estrogen metabolism, really important for all those degradations. And estrogen makes a big difference for autoimmune conditions. So that's why it's important, amongst other things like, happiness.
Who needs to be happy?
Who needs to be happy? So beyond the box, we started the pharmaceutical medications, and those are important and have their place. And I have plenty of patients that I co-manage with their rheumatologist, or I even manage their rheumatologics. And then natural treatments, which are also very, very useful, and some people only want to go this way. And then put them together, and I put this in the integrative therapies box.
The best of all worlds.
Why? Why choose when you don't have to?
Why not
Just
have
use the best of everything?
All right. So now that we know all the testing and what we're looking at, and I hope you know that we really emphasize test, don't guess. It's really important. In all the years that I've been a health coach, and everybody who's like, I don't want to test, they get sicker and sicker and sicker, and finally they test. And then it's like, well, no wonder I'm eating everything that I'm allergic to because that's all my favorite foods, or, things like that. And so once you have answers, you are not a victim. There's so much in your control that's going to make your medication more effective, You will be able, many people, depending on the autoimmune disease, can get off of pharmaceuticals. If they're able to like, you save them for a flare-up. I mean, it really depends on the autoimmune disease, but some of them have gotten off of them. And completely gone into, I guess it's not remission, but asymptomatic. And their flare-ups are further apart, less severe. They don't last as long. They don't require as much pharmaceutical intervention. So you have a lot in your control, which is great because you felt out of control for so long. And now that you have answers, there are things that you can do, and that's really exciting. Thank you. All right, so first up, my favorite topic, which is what do you eat? Now, there's a lot of different diets out there. There's the Walls protocol. Dr. Amy Myers has a protocol. And then there's like the autoimmune diet, and then you have the autoimmune protocol. So I'm going to focus on just a regular healthy autoimmune diet versus an autoimmune protocol. So a lot of people put the autoimmune protocol in the lifestyle category. It's kind of like the same thing with a FODMAPs or something like that. It has its place. It is a great therapeutic diet. If you are in a flare-up and it is just out of control and you want to remove everything potentially irritating to the immune system, this is great for short term. I feel like people do best on it for about a month, not longer than that, because it restricts nuts, eggs, shellfish, potatoes, sweet potatoes. I mean, it restricts a lot, but it's everything that's potentially irritating to the digestive tract, and it gives it a break. And that's really important because your gut is your first line of defense. That's where 80% of your immune system is. And if you have foreign food particles coming in, when it should only be nutrients and neurotransmitters and things like that, the body's in the attack mode. And then when it does it for so long, this is one trigger for autoimmune disease, is that on a cellular level, the food looks like cells of your body, and that's what it starts attacking, right? So the autoimmune protocol has its place, and it's a great protocol, but it is temporary. It's a therapeutic diet. And then you have a regular autoimmune diet, which is an anti-inflammatory diet. And there's like foundational things, like you really need to go gluten-free. And then you want to remove your food sensitivities, and you want to get them tested in a year because they do change as you heal your gut. But it's an anti-inflammatory diet. It's really high in produce, especially vegetables. You have lots of healthy fats because that's your source of calories. And then you have moderate amounts of protein. The paleo diet, if it's done correctly, is a great autoimmune diet. And so what you eat really matters. This is really the foundation. Is you want to heal the gut, and then you want to make sure you're avoiding the foods that cause your body to get inflamed. And if you're in a flare, the autoimmune protocol is definitely a tool in the toolbox. As we talked about, you want to make sure you're addressing nutritional deficiencies and genetics. You want to make sure that the supplements that you're taking, your body is actually able to absorb them. That's really important, making sure they're bioavailable. And if your GI tract is truly compromised, an IV therapy is a great tool in the toolbox. It's one of those things that I've known about and I've recommended for years, but I actually just got my first one like 2 weeks ago. It was amazing, absolutely amazing. And now I'm like setting money aside every time so that I can like get one whenever I need it. And like we talked about, sometimes for certain people, folic acid is toxic, and you have to get specific vitamins that use methylfolate, okay? So that's really important, because if you don't address this part of it, you're not going to get better still, or it's going to be much more slow going, because you have to heal the gut to be able to absorb the nutrients and get your microbiome to a point where it's balanced enough to absorb the nutrients. Like, there's a lot that goes into it. And then again, knowing which medications are detrimental to your health, or you metabolize fast or slow, because that changes the dose. My best friend got this panel done, and it was a game changer, because she has a genetic condition and she gets hospitalized, and knowing which medication she shouldn't take is huge. And when you have an autoimmune disease, especially when you're in a flare, it's really good to know what medications your body is going to react to, positive or negative, and if it's going to be fast or slow. I totally took this from you, but
no, go for it.
This is something that as a health coach, I really, because they can be expensive at first. We always talk about in the functional medicine world, like allopathic medicine, which is mainstream medicine, is an upside down pyramid. It's really inexpensive at first with cheap co-pays, and then it gets more and more and more expensive because you never address the root cause, you're just masking symptoms, where we're a pyramid where the investment is really big up front and then we work ourselves out of a job. Mm-hmm. Because then you get to a point where you're healthy, you know how to take care of yourself, you're empowered, you know all the tools in your toolbox. You say, hey, I got a flare coming, we evaluate you, and then like we don't see you again until it's your well check in a year, or you're sick and you want an immune shot, right?
I get emails from patients all the time who are like, oh, I just want to let you know I was sick last week, or I had a flare last month and I just did everything that you always tell me to do and it's all better, but I thought you should probably put that in my chart. I'm like, great.
And it's great.
Job.
Yeah.
It's fantastic.
But we work ourselves out of the job. But this is a huge part of it, that especially the medication part, when by the time people come to me, they don't trust doctors. They're really frustrated. They don't want pharmaceuticals poisoning their body, which I think is great. You don't want to depend on them. But they have their place, so let's know what works. And let's make sure you're absorbing what you get, or you're getting, because if you're really tired, getting an IV is going to give you that boost you need right away so that you have the energy to cook and go to the grocery store, or even go on Fry's click list or Whole Foods click list and click the button. Because sometimes, especially the really severe flare-ups, they're in so much pain or they're so tired, adding anything else in what they're used to is just, it's too much. And so getting a nutrition IV or something like that can really get people over the edge to where they can do the things they need to do to get healthy.
You can take all the oral supplements you want, but if your gut is messed up, if you've irritable bowel syndrome, if you have irritable bowel disease and you're not absorbing it, I mean, my IBD patients, they know they're not absorbing anything. They absolutely know they are not absorbing anything. And that's when we can do amino acid IVs, we can do nutrient IVs, vitamin C IVs, and those are super important. But again, testing, if somebody has irritable bowel disease, there's no way I am not testing what bacteria, yeast, beneficial bacteria are growing in their gut. I want to know exactly what's going on in there.
Yep. All right. So we talked about this. The first line of defense is your gut. So you have to make sure that this is functioning properly. And it's not like you can just take a probiotic and it works. Like there's no magic bullet. Okay, unfortunately, I mean, probiotics are amazing, they're necessary, but it's not a magic bullet to get you digesting food and absorbing them and all of that. So your food plays a huge role. Again, if you get your food sensitivity panel and you're like, there is no freaking way I'm giving up gluten. I gotta have my pizza, I gotta have my pasta, or, I'll just like eat it when I go out to a restaurant, and I'm not gonna tell them I'm gluten-free, but I'm just gonna order the stuff that doesn't have gluten in it. I'm sorry, that doesn't work, okay?
You'll feel it. You'll feel it.
Yeah, you're never going to get better. But it's also your stress, okay, and supplements. So all of this stuff has to work together. And it's exercise, and it's fiber, and it's, excuse me, I'm not contagious. My asthma's flared up. So I have like this little cough. So I'm sure you've been hearing it and been like, what is going on with her?
Who covered their mouth at home? Did anybody cover their mouth? I always think that's super funny because now I do a lot of telehealth and people are like, yeah, you're not wearing a mask. I'm like, I don't, it's a computer. It's cool. So I know, we forgot.
Yeah. So I have asthma, and I talked about that. That's one of my conditions, and it's flared right now. So I just have like this little bit. And today I went to the parking lot, and it was like covered in yellow dust. And so it's just been an extra day today. I really want to hit on stress, because I don't care. You can eat all the right foods. You can do all the right things. But if you don't manage your stress, you're never going to get better. Stress will keep it'll prevent the gut it'll prevent it from healing. It will, if you think about it, if you think about how nervous you get before speaking, and you're you have heartburn and your stomach hurts. Like I remember the first time I started doing public speaking, in front of all my high school buddies, and half of them hate you and they're judging you, and you just literally feel sick to your stomach. So that's an immediate response, but it happens all the time. Chronic stress, it prevents you from healing. Your body or your mind is powerful, And if your mind's not right, your body's not going to be right either. So we've talked about this a lot in, I think it was the Immune.
It was the Immune where we talked about cortisol, we talked about sleep.
I mean, we go like in depth for like 20 minutes just on stress management and the impact of stress. And that video is on YouTube on, if you Google Dr. Mary Kay Geyer, it'll come up, and I highly recommend watching that one, especially if like you know that stress is an issue, but you like don't like know it's an issue. I recommend checking it out, because if you have autoimmune disease, this is more foundational than what you eat. Mm-hmm. You have to make sure that your self-care is preventative and not reactive.
Because remember, your body's already attacking itself. And so all you need is that cortisol to spike up. Now, your cortisol spikes up and you're going to spike your glucose up and your insulin up, and it's going to cause more insulin resistance, and it becomes this horrible cascade.
Yeah. All right. So we've given you a lot of information. So what can you do right now? Like if there's two places that we think are foundational to start. So if you like have been diagnosed with an autoimmune disease and you feel like, I'm not ready to spend money on seeing a new doctor again and getting more tests done again, this is where we recommend starting. So we have our top 5 supplements that we recommend for anyone who is newly diagnosed or new to lifestyle symptom management to start here. And then again, autoimmune disease is where I got my start. I'm incredibly passionate about it. And so I was a co-author to a cookbook called The Dish, a real-life guide to eating for autoimmune disease. The real life part is really important to me, because it's what can you do long-term that's comfortable and easy, because that's the only way you're going to stick with it. Yep. It's the only way. You have to make it so that it's easy and almost mindless, because that's how we work, because we have a lot of stuff going on. We can't think about things all the time. So this is, it's over 100 recipes that are super simple, they're flavorful, they're easy to make, and there's about 45 pages of easy reading. One of my friends who hates to read said that she finished it like in one night, and she found it really helpful. And it's available on Amazon and on Kindle. And then we're gonna be giving away one cookbook today. If you left a comment and you bought a ticket, we're going to do a draw. So we're super excited about that. But like, I want it to be real life, and then we got to get those nutrients up, because that's super important. Yep. And we're going to dive into what those 5 are and the ones that we personally recommend, because not all supplements are created equal.
They are not. And so these are really important ones. One of them being a probiotic. I often get people that come in the door and they say, well, I've been taking a probiotic forever, and we're on a stool panel and they have nothing. Or they're taking a probiotic. Every time they take it, they get sick. That's a big one I hear. It's like, no, every time I take it, I get bloated. I'm like, then you have something abnormal growing in your gut. That's a big key symptom, is because most of those probiotics have something called fructooligosaccharides in them. And so what that does is it feeds bacteria. And so it'll feed your beneficial and your abnormal bacteria. So I don't tend to give probiotics with FOS in them. Sometimes I do. HMF has a bunch of really good probiotics. But for my autoimmune patients, I really like Lactoprime Plus. Lactoprime Plus by Claire. And so what I want to kind of point out is, first of all, these are live organisms. So any probiotic you're getting that is not in the refrigerator, you're probably not getting anything. It's a live organism. It needs to be refrigerated.
Also, if it has digestive enzymes in it, you're not getting anything.
The digestive enzymes are killing the probiotics. So if you have a probiotic in your protein shake, you're not getting probiotics. I'm sorry. It's just not happening. If you have it in your digestive enzymes, if you have it, they have lots of combination supplements, and they throw in one lactobacillus strain. They're like, there you go. It's a combo product. We can charge more. And I'm like, nope, no, you can't. No. You're wasting that part of it. And the rest of the supplement might be good. But for probiotics, live organisms, I actually keep mine in the freezer quite a bit, or the refrigerator. But in the office, you'll see they're in the freezer. No FOS, so that fructooligosaccharides that's going to feed all the bacteria in there and give some people the bloat. And then strains matter. So this is actually, it gets a little bit nuanced. I won't go into it. We tried to figure out whether or not we were going to go into different autoimmune diseases and give more detail. And there's just, how would we go into?
No, we have to literally do one webinar on every single different autoimmune disease. Because
there are actually certain strains that are associated, like low amounts are associated with certain rheumatologic diseases, or high amounts are associated with upregulating inflammatory cytokines. It gets really, really complicated in that. So this is just the general one that I recommend. It has lots of lactobacillus, it has lots of bifidobacterium, multiple strains, 25 billion, and it's, I don't have to worry about any of the other, excipients or things that they throw in there. They also have Lactoprime Plus, it doesn't show it here, but it's SCD, so specific carbohydrate diet. I use this with my gut patients, period. So it's made for those people that get gut symptoms when they take probiotics. They don't have an abnormal reaction to it. All of my SIBO patients are on it. And a lot of my large intestine bacterial or fungal overgrowth are also on it. Okay, you can't see this, but if you get the PowerPoint, you'll be able to see it a little bit better. What I wanted to show you was, this is omega-6s. These are omega-3s. I know the PowerPoint is backwards. Keep in mind, we're sharing this live on Instagram, Facebook, and doing a share party. That's why we have 3 computers and some phones going. So I know it's backwards for some of you, I'm sorry, but you can get the gist of it, is that these omega-6s, the standard American diet, is very, very pro-inflammatory. You know that. We know it, we make excuses, it is. Down here you can see the specific cytokines that pop up that are pro-inflammatory. Over here, omega-3s are anti-inflammatory, and these are the prostaglandins that are anti-inflammatory. So it actually drives these anti-inflammatory pathways. And you'll be able to see that more. And if you want something specific in this where you don't see it as well, you can always send us a message and we'll try and get that to you. This is one of my favorite fish oils. I would say most of the time when people bring in their fish oil, I pop a hole in it. So if you're my patient, you might have seen this already, where you're like, I remember when she did that. I'm like, I open it up. I'm like, can I take it a capsule? I pop a hole in it with an acupuncture needle. I squish it out and I'm like, you smell that? They're like, that smells awful. I'm like, that's because it's making you sick.
It's rancid.
It's rancid. So fish oils should always be refrigerated. There's actually on the back, it'll say like, store in a cool place. I did a post on this on Instagram a while back, but I blew it up where it says, store in a cold place, because it's the oil of a fish. Now you can get there with algae oils if you're a vegetarian or a vegan. I will tell you, it is really hard to get your omegas up on those. So if you're not, this is important. A lot of these come from sardines. Some people like cod liver or krill.
Or if you're allergic to sardines, like your husband.
So my husband, I had him on fish oils forever, and then we did an allergy panel on him, and it turned out that he had a sensitivity to sardines, and so then we had cod and krill on board. So, but this is the main one that I recommend. Okay, glutamine is huge. Now, here's the important thing, is glutamine's used for a lot of things. If you've ever had a workout supplement, then it's in there because it builds lean muscle mass, because you need it to build muscle.
Doesn't it speed recovery?
It does. But really it's the lean muscle mass, and you will notice that I put it in my protein shake every single morning because there's so much stuff that bombards our guts. But it's also fuel for the intestinal cells, and it helps them turn over faster. It is the #1 thing you can do for your gut, and you can get them pretty inexpensively unless you have celiac. And so that's why I pointed this out, super important. So this is actually from an Instagram post, Facebook post from a while back, where I showed people what to look for if they do have celiac or gluten sensitivity, because they're not all the same. Glutamine powder, I'm always starting at a minimum of 3 grams, but I'm usually up at like the 5 grams for a lot of my patients. But if you do have those, you should look for gluten-free, non-GMO. This one happens to be vegan and vegetarian, and it is certified gluten-free, so I put arrows to that. So make sure you know what you're getting when you get it.
If you want to get, I think the best way to get it is pure, which a lot of the stuff you're going to get, even at health food stores, has fillers in it. So just because it's coming from a health food store or a supplement store does not mean that it's pure, and you get it and it still might be harming you. Any, high quality matters, price matters. You get what you pay for. The cheapest is not going to be as good, unfortunately.
It's true. Multivitamins talk about in basically every single one of our talks, because if I put, it doesn't matter if you have an autoimmune disease or not, my patients know I want you on a multivitamin, I want you on a fish oil, I want you on a probiotic. Usually I'm putting my patients on green drinks too, because vegetables are amazing.
And it's an easy way, because a lot of people don't like vegetables. So I'm a big fan of the fruit and vegetable powders, because people, what happens is they're on them for a while and then they start craving salads. It's like my favorite thing, where they're like, I just craved a salad. It was the weirdest thing. And I'm like, yeah, it's great. All right, sorry to
It's all good. And so this is my favorite. You'll see this is gluten-free, non-GMO, hypoallergenic. It doesn't have a bunch of fillers in the capsules. I can't show you the back because the label literally has so much stuff in it. That is the best multivitamin. And
it also has minerals in it too, right? Like it has both.
Yep.
And an antioxidant blend?
It has an antioxidant blend in it, and it has MTHF, which is methyl tetrahydrofolate for my people who have MTHFR defects. So this is definitely my favorite. Now this comes with iron and without iron. I always get the one without iron unless somebody has an iron deficiency, because we don't want to get too much iron. But they also Pure makes a pack I'll use for some of my patients. They make a women's pack and a men's pack and a lean pack. And I like them. I like them a lot. I don't love them as much as this because they don't have quite as much. And oftentimes, if I'm not in control of the supply chain, the fish oils might have been heated while they were shipping. So that's kind of the one little nuance of that. Okay, and then digestive enzymes. Now, for people with autoimmune diseases, you have a hard time breaking things down quite often. And so I want to make it as simple as possible for you. I want to make sure that anything that you're eating, you're able to break down. Digestive enzymes just help with that. They're not just for when you get indigestion or reflux. They're not always long-term, so that's super important to know.
Yeah.
There are lots of strains. Now, Similace is one of my favorites because they have a bunch of different ones. So they have GFCF, which is gluten and casein. They have free. They have one that's sensitive for people who get really sick when they have digestive enzymes. Those are a couple of my favorites. Okay.
Woo! That was a lot of information. We hope that you found it helpful. Again, if you want to see the PowerPoint, make sure that you send us a DM with your email. You can sign up for it directly on my Facebook page or go to my website. Dr. Geyer, we don't have that set up yet, so just send her a DM with your email. We'll add you to the list, and then you will get the links to today, and then we'll upload it to YouTube in the next week or so. It takes a really long time. Sometimes it takes a few hours that the computer has to be up, and if it falls asleep, it interrupts it. So be patient with us, but we do try to get it up within the week, again, to the YouTube channel, which is Dr. Mary K. Geyer. And we will also send out a link to all of these supplements. We have, in Full Scripts, there's like a little section that we call autoimmune disease. And it has all 5 of these that we showed you so that you can start getting quality supplements right away and you know that they're going to be good. So if you're going to invest in something, make sure you know that it's going to work.
Yep.
And then if you want to talk about diet and lifestyle and you want a little bit extra guidance, then set up a consult with me. It's a free 30-minute consult. We'll video chat. I'll kind of see what's going on and let you know all the different options that I have for you to be able to support you on your journey so that, again, it just takes that extra layer of thinking away so that all you have to do is start doing it. You don't have to guess. You don't have to read. You don't have to spend hours on Pinterest and blogs and books and all this stuff. Like you can get someone who, I have 8 years of experience working with a variety. I've probably worked with 12, 15 different autoimmune diseases ranging from MS, celiac disease, of course. Again, some of the more rare ones like my dad has, POTS. I've had a client who did have the disconnective disorder, the disconnective tissue disorder, Schwann's disease. So there's a lot out there that I'm able to really help with. And that's what we want to be a resource for you, of course.
There's so much that can be dialed in, and again, there was so much that we wanted to put in here, and it was hard to get through it, and I really wanted you to see like what these tests look like and what it looks like when you can dig through the rabbit hole and find some answers and then dial in treatments, because it's all about that, knowing what your domino effect was, getting your dominoes actually treated, which may be different than somebody else's. So one patient of mine that has lupus, I've at this point thousands of patients, because autoimmune is so prevalent in our society. And so one lupus patient is not going to get the same protocol as another lupus patient. And then we didn't have time to touch on it, but for a lot of patients, I really love low-dose celecoxib because it calms down the immune system. And so if that's something you've never heard of, really start looking into it. Because it can be a game changer for people. Now, in and of itself, that's not the only thing I'm ever going to do with somebody.
So like we said, there's no magic bullet. It really takes an integrative approach. And so again, like if you really want some specific help, we are here for you. And we're telemedicine right now in today's world. So you can, I think, are we seeing people in the office now?
We're spacing them out very, very carefully. We have been since the beginning. So
yeah. And again, you don't have to leave your home. You don't have to worry about it. And we can start giving you the guidance that you've been looking for.
The other thing I wanted to kind of pop in and say is, just as a reminder, I mentioned this a couple of times, but we are live on Instagram and Facebook and her pages and my pages. And so we got a lot of questions that came in during, and we weren't ignoring you. I'm so sorry. It was just a little bit too much with the tech and just us in here.
Yeah, we don't have an assistant reading stuff for us.
So you can feel free to post questions. If they're general questions where it's not something that
you're not really, like, hey, this is my blood work. Can you tell me what's going on?
Right. Like I can't help you outside of a medical visit for that. But giving a little bit of guidance here and there, general questions, or maybe busting some myths, put that in the event, and we'll try and get your questions answered. And then we're doing this every month. So if there are other things that you really want addressed, next month we're talking about men's hormones. And so that's going to be our focus. I'm really, really tired of things being treated poorly. So that's my next one, because I've had a slew of really bad men's hormone patients lately.
I feel like men kind of get the bottom of the barrel
guys,
treatment, because it's like men don't have hormones or something. I don't know what that is, but you do, and we want you feeling good as much as we care about women. So
let us know what you want to hear about. All right. Thanks so much for joining us.
Bye.
Bye.